I'm going to explain more about why I don't believe Lyme disease, if you want to call it that, is an infection, because there's a lot of pushback on this from the Lyme community. And some of the other doctors that have worked with Lyme patients for a long time like to point out that I'm not an LLMD, which stands for Lyme Literate Medical Doctor. And all I can say to that is whatever. I mean, there is no degree or training program that leads to the designation of LLMD. It's sort of a self-designated distinction. And in my opinion, everyone who's been treating Lyme disease for the last 10, 20 years has been doing it wrong. So I'm proud to not be an LLMD, whatever. Reasons why this is not an infection. One, like I mentioned in another video, you can treat people with antibiotics for years and their disease keeps coming back. That is not how infection behaves. Osteomyelitis, which is a bacterial infection in your bone, endocarditis, bacterial infection in your heart valve, you can clear those in 6 weeks of IV antibiotics. So if you're trying to kill something for 6 years with IV antibiotics, you're not treating an infection. Another bit of evidence is the presence of a Herx reaction. The Herxheimer reaction, Jarisch-Herxheimer reaction, technically, indicates that the symptoms are immunologically mediated. Because when you start killing the organism, you first get an increase in exposure to the organism's parts itself, this explosion of dead bacteria. And if that accentuates the disease symptoms, then those symptoms are immunologically mediated. That sort of defines the condition wherein a Herx reaction would occur. So it's immune mediated. The other issue is, and I run into this a lot, people are of the mind that if we use LDI and we establish tolerance for these organisms, then what's going to happen, and this fear is propagated by your LLMD community, the fear is that these organisms are going to run unchecked through your body. They're going to destroy the person, eat your brain away, eat your muscles, eat your joints. The bacteria are just going to consume you. And that's an interesting theory, and I can see where it comes from, but it's clearly not true. For one thing, I've treated 600 or 700 Lyme patients now with LDI. Not one of them has had that happen. And many of them are like totally asymptomatic on a long-term basis now, dose after dose with LDI. So promoting tolerance to the organism has not led to any increase in the disease process. Another bit of information against that is that you see lots of people who test positive for the Lyme organisms and aren't sick at all. The general population at large, most of them will test positive for these bacteria, and they're not sick. So you can't claim that having the organisms in your body leads to this cascade of accelerating illness. More information on this fact is that if you put someone on immunosuppressive drug therapies, like the drugs for autoimmune diseases, or cancer drugs, or immunosuppressive drugs to prevent rejection of a kidney transplant or something, those people don't get Lyme disease, okay? They don't start having Borrelia crawling out of every orifice. They don't die from overwhelming infestation with these organisms. And neither do AIDS patients. AIDS patients will show you what a real pathogenic organism is. And yeast is on that list. Yeast will start to consume those people. The herpes viruses will come out of the woodwork on those people, things like that. Which is interesting that we can also treat a lot of diseases associated with those organisms with LDI. But you do not see AIDS patients having Lyme disease. You do not see Lyme disease or associated features similar to Lyme as one of the AIDS defining conditions. So there is absolutely no evidence that derailing the immune system in any manner leads to a worsening of Lyme disease. And what we're doing is establishing specific immune tolerance to the organism to turn off an unnecessarily aggressive immune response, which is not the same thing as weakening the immune system's defenses at all. And that leads into a discussion of the difference between the innate and specific immune system, which we'll talk about next.